Welcome back to Idaho Today. September is Gynecological Cancer Awareness Month. So for this week's Life in Balance, we sat down with St. Alphonsus GYN oncologist Pat Connor to talk about the 4 different types of gynecological cancers that are the most common, and we discussed the signs, the symptoms, and the risk factors that women need to keep an eye out for. Dr. Connor, what are the typical cancers you treat in women?
Sure. As a GYN oncologist, the most common gynecologic cancer is endometrial cancer, ovarian cancer is second, cervical cancer is third, and vulvar cancer is fourth.
Okay, and what are the symptoms for these cancers? Are they different for each type?
Yes. So endometrial cancer, the most common cancer in the GYN tract for U.S. women. 80% of women will have bleeding. 10% of women will have purulent vaginal discharge. Only 10% of women are asymptomatic. For cancer of the ovary, bloating, fullness, very non-specific, heartburn, urinary frequency, constipation are the symptoms. For cancer of the cervix, I'm afraid there are no symptoms. You don't become symptomatic until you have an invasive, advanced process. And that's how pap smears are so helpful, by picking them up early. For vulvar cancer, same thing. There are no early symptoms until you have an advanced cancer.
Okay, so that kind of highlights the importance of screenings, right? How important are they?
Well, for cancer of the cervix and cancer of the vulva, without screening, you're not going to pick it up. And same thing with cancer of the ovary, which is the most lethal gynecologic cancer and the 5th most common cause of cancer death in women. That unless you have a high index of suspicion, you're not going to pick it up.
Okay, so if women are experiencing any of the symptoms that you listed previously, what should they do?
First thing, contact your primary care doctor. So anytime a menopausal woman bleeds, that is abnormal. Okay. She needs an endometrial biopsy right off the bat. Number 2, if she has a lot of bloating, fullness, constipation, she needs to talk to her primary care doctor. And this could also be symptoms of colon cancer, ovarian cancer, so she needs a workup and an exam. For cancer of the cervix and cancer of the vulva, a lady just needs an annual examination. She doesn't need an annual pap smear necessarily, but by coming into the doctor, getting in lithotomy position, that's the position of a pap smear, the doctor can examine her vulva, her groins, her anus, place a speculum, examine her vagina, cervix, and do a bimanual exam, palpate her ovaries. The exam takes 2 minutes and it is life-saving.
Wow, 2 minutes could save your life.
You bet.
All right, so if someone is diagnosed though, what type of treatments do you do here at this clinic?
Sure. So cancer of the endometrium, the most common cancer in the GYN tract. 1 in 40 women, or it's estimated this year, 66,000 U.S. women will be diagnosed. Primary treatment is a hysterectomy with lymph nodes, and then possibly postoperative radiation or chemotherapy pending the findings. And then for ovarian cancer, the mainstay is surgical debulking followed by chemotherapy. For cervical cancer, surgery or radiation, and same thing with vulvar cancer, surgery and or radiation.
And you had mentioned menopause. So does menopause increase a woman's risk of cancer?
Well, we find the majority of these cancers in the menopausal state. So for example, cancer of the endometrium, the most common cancer in the GYN tract. Only 5% occur in women under 40. 75% occur in women over 50. For cancer of the ovary, average age is 63. For cancer of the cervix, it is sort of split. Younger women can get cancer of the cervix. It's driven by the HPV virus. And cancer of the vulva, just the opposite. 50% of women who get cancer of the vulva are over age 70. Okay. So it's an older lady's disease.
And when it comes to these illnesses though, are there ways that women can reduce the risk of cancer?
Oh, for endometrial cancer, the biggest driving force is estrogen. And obesity is a big driving force for that. So the baseline risk of this cancer in a U.S. woman is 1 in 40. If a woman weighs 50 pounds over her ideal body weight, her lifetime risk of this cancer is 10 times higher than the baseline population. Wow. So unopposed estrogen, obesity, these things increase the risk. Ovarian cancer, obesity is associated with it. Genetics are associated with it, so knowing your family history. Cervical cancer, being exposed to the HPV virus, cigarette smoking, anything that's immunocompromising, lowering your immune response. And vulvar cancer also associated with the HPV infection.
And where can women go to learn more? Thank you so much for all this knowledge, but where can women go to learn more, especially if they are starting to have these symptoms or they're just trying to prevent?
Sure. You go to stalphonsus.org. It has all the information, primary care doctors, specialty doctors, radiology. We have it all if needed.
Thank you so much, Dr. Connor.
Yes, ma'am.